Hi, I'm Dr. Anusha. I'm a consultant pediatrician at Manipal Clinic's Brookefield. It's nearly June and many schools are reopening. Lots of the older children are already back in school and many of the younger children are now transitioning from online to offline school. So this can be an anxious time for both the children and the parents. So the most important step we can take before sending children back to school is vaccination. Vaccination of all the adults at home and all the eligible youngsters more than 12 years of age. So this vaccination will provide an extra layer of protection for the younger children when they go back to school. The second important thing is counseling the children. Especially the younger children are going to be very anxious about going away from home and going to a new school. And some of them may have fears about getting infections when they are in school. So it falls to us to address their fears and their anxiety and reassure them to make this transition easy for them. There are some children who suffer from other major illnesses like heart diseases, kidney diseases, diabetes, asthma. It will be a good idea to have a discussion with the pediatrician about any additional precautions which they can take before going back to school. So the first step is to provide a well-fitting mask for the child. So the mask should cover the mouth and the nose and it should fit well so that the child doesn't have to repeatedly adjust the position. And the second thing is to teach the children to wear and remove the mask properly. They must be trained to remove the mask using the ear loops and they should avoid touching the cloth cover of the mask in the front. We can have practice routines at home to wear and remove the mask so that the children are more confident when they get back to school. And it's important to diligently label the masks of the children so that there is no mix-up when they go to school. It's a good idea to provide a backup mask with them in their bag in case their mask gets dirty or it becomes wet. Also, during lunch hour or when they drink water, children will remove their mask. It will be a good idea to provide a small box or a small bag so that they can put the mask during those times inside the bag. And we must always remind them not to share or trade their masks with their friends. So with young children and toddlers, it's not always practical to practice safe distancing inside a classroom, but we can do our best. We can ensure that their desks are apart as much as possible, and we can ensure that the children don't participate in large assemblies or large gatherings. We can request the school to reduce the number of students traveling in buses or vans to school. And also we can encourage the children to participate in a lot of outdoor activities so that they are not indoors all the time. So all of us, including children, have been diligently hand washing for the last 2 years. All the same, it's good to remind the children of hand washing routines when they are going back to school. It's important that they wash their hands using soap and water for at least 20 seconds. It's commonly recommended that children can sing a nursery rhyme when they are washing hands, so that the hand washing routine should last as long as the nursery rhyme lasts. So that this ensures that they wash their hands for at least 20 seconds. And we must remind them to wash their hands before and after eating food, before and after handling their mask, after using the washroom. And we must teach them to avoid touching their mouth and their face as much as possible. In addition to these behaviors, it's important that the children maintain good overall hygiene. If any of them are feeling unwell while they are at school, they must report to the teacher as soon as possible. If they are unwell at home, it's best to refrain from sending them to school for a few days until they are better. If the child has persistent symptoms, it's good to see a pediatrician before sending the child back to school. Also, we must remind the children not to share their food or share their water bottles and spoons while they are at school. In this way, we can make a safe transition from online to offline schools, especially for the younger children. Thank you.